All right. Hi, my name is Molly McDonald, and this is my interactive case study 1, tissue plasminogen activator presentation. So to begin, let's talk about what a stroke is first of all. So a stroke is a loss of blood flow to a part of the brain that causes brain cells to be unable to receive the oxygen and nutrients necessary to sustain the body. When a stroke occurs, it can cause brain damage, resulting disabilities, or even death in severe and/or untreated cases. There are two types of stroke events, the first being the ischemic stroke, and this is caused by a blockage of a vessel, such as a blood clot or a plaque buildup, and this blocks the arteries supplying blood to the brain. This causes a lack of oxygen flow and nutrients to the brain and can possibly lead to major cell damage or even death. Ischemic strokes account for about 87% of all strokes, and the main causes include, but are not limited to, blood clotting, arterial spasms, and/or arteriosclerosis, which is the stiffening and decreasing sizes of arteries within the body. The second type of stroke is the hemorrhagic stroke, and this is caused by the blood vessel rupturing, such as through an aneurysm or an arteriovenous malformation, that may occur in the brain and lead to internal bleeding into and/or around the brain. With bleeding occurring in such a sensitive part of the body, pressure is placed upon the brain tissue that disrupts the normal function and can cause major damage. These types of strokes account for about 13% of all strokes, and the causes of them include, but are not limited to, trauma surrounding the head and/or brain, hypertension aneurysms, which are the weakened blood vessel walls, and arteriovenous malformations, which are abnormal knots of blood vessels. So, moving on to the first line of defense. In the past, the first way to combat ischemic strokes were to use OTC anti-inflammatory agents such as aspirin. Aspirin is a very commonly sold and used over-the-counter anti-inflammatory agent that inhibits platelet irrigation and clot formation. This helps to remedy damage done by preventing further blockage of affected blood vessels, and it is not ideal to be used for severe strokes or for long periods of time because although it can reduce the risk and severity of an early recurrent stroke, it could potentially make bleeding strokes far more dangerous overall. So, following this, the FDA only approved one drug for the treatment of ischemic strokes, and this was called a tissue plasminogen activator, or more commonly referred to as TPA. TPA is a clot buster that is sold underneath the name of Altiplase, and it is also known as a natural enzyme that assists in the dissolving of blood clots regularly within the body. TPA is primarily used for ischemic strokes to restore the blood flow to the area that was damaged in the brain that was affected during the stroke to minimize the overall damage. It is optimal to be used to minimize adverse effects, and research has proven that it does improve the damage done by strokes for the affected patients. So, TPA on a cellular level, it has a certain mode of action that begins with the conversion of plasminogen, which is an inactive enzyme present in the blood. And this converts into plasmin, which is its active counterpart that works to dissolve fibrin, or in other words, dissolve the protein that forms blood clots. This allows plasmin to break down the fibrin meshwork to break down the clot structure and overall just dissolve it. In TPA on a molecular level, it interacts with fibrin within the clot using its catalytic domain. This signals and initiates a multitude of reactions that ultimately lead to the clot being dissolved and therefore destroyed. This catalytic domain of TPA binds to fibrin and is able to activate the plasmogen that is bound and turns it into plasmin to combat the bonding occurring. So, the structure of TPA, it is known as a glycoprotein that is made up of 527 amino acids with a complex 3D structure. It has specific regions that are responsible for dissolving clots. The catalytic domain of TPA is where the interaction with fibrin occurs, and plasmogen is activated. Its structure allows it to be selective in binding, namely to fibrin, with the clots of interest and minimize any non-targets and the risk of further bleeding. And up in the right corner, you can see that is the catalytic domain. The function of TPA, so it has very specific functions to bind to fibrin at the site of the clot formation. And by binding to fibrin, TPA is able to interact with plasmogen and therefore activate into plasmin. When activated, plasmin has the ability to break down the fibrin strands in the clot and therefore dissolve the clot to restore normal pathway functions. So, in summary, overall TPA is an incredibly important drug used to treat ischemic strokes through the conversion of plasmogen into plasmin to allow the breakdown and dissolving of clots affecting the body. And that concludes my presentation. Thank you so much for listening and have a great rest of your day.